Welcome, everyone. I'm Assemblywoman Donna Lupardo, and I'd like to welcome you to our tick season webinar. We're going to be talking about a bunch of things that are very important to your family, to your loved ones. We're delighted that Dr. Nagaraju, who is the Distinguished Professor and Dean of the Pharmacy School at Binghamton University, has put together a panel of folks who are going to talk about how Lyme disease is a growing problem, especially in our region of the state, what to do if you get a tick bite, and what types of treatment protocols are available if this does happen. You know, at the state capitol, we have been talking about the importance of paying more attention to Lyme disease, of educating the community. And it wasn't until my husband got Lyme disease that I learned that we don't have insurance coverage for Lyme disease. It's very surprising to a lot of people, and we're going to continue working on that. We're also working on getting just a basic database going at the state health department so we can find out about the incidence of Lyme disease across the state. So this is important to me, my family. It's important to all of my constituents, and I'm very happy that you've tuned in to learn more to protect your family as well. And I'm going to turn it over to Dr. Nagaraju, again, the Dean of the School of Pharmacy, who's going to introduce our distinguished panel. Thank you.
Thank you, Assemblywoman Lupardo, for the kind introduction. The School of Pharmacy, Pharmaceutical Sciences, since its establishment in 2016, is involved in tick-borne diseases. And also at the same time, the Binghamton University has been working on the tick-borne diseases for many years. So the mission of our school is to work on the local health problems. As Assemblywoman mentioned, this problem is right here in our area. So I would like to now introduce Professor Etrib Hathout, who is the Director of Tick-Borne Disease Center at the Binghamton University. And Professor Hathout is a professor of pharmaceutical sciences and have been looking at tick screening at the school, at the pharmacy school.
Thank you, Dr. Nagaraju. And I am here to talk to you about the Lyme disease in Northeast, and especially in New York, and the public health concern. This disease is on the rise, as well as other tick-borne diseases. And this is a map showing the reported cases from 2019 to 2022. And you can clearly see the increase in different tick-borne diseases, including Lyme diseases. Next slide. And here I am breaking down into different diseases. Here, Lyme disease, you can see in green, and all the Northeast, and especially upstate New York and Mid-Atlantic is an increasing number of this disease, as well as anaplasmosis and babiosis. They are on the rise in these areas. The spotted fever is mostly in South, but it's also increasing, and some cases has been seen in the Northeast and in New York State. Next slide. This is just to show you in 2022, there were about 33,000 cases of Lyme disease reported in New York State. So the highest number is in the Mid-Atlantic area. So what we do in the lab, we collect ticks in the Bloom County area in state parks. This is showing us Shenango Valley Park, where we collected about 100 ticks by dragging a white cloth. And those ticks, we put them in a tube with ethanol, so they die immediately. And we can show you here magnified Ixodes scapularis tick, or called black-legged tick. And this is a female tick. And we remove the legs and we crush the whole tick and we put it into a mass spec analyzer where we can detect the pathogen that tick carry. Next slide. We published a paper in 2022 where we analyzed single ticks, more than 30 ticks, collected from Chenango Park and other state park. Unfortunately, half of them carry the Borrelia burgdorferi that cause Lyme disease. So you have 50% chance to get Lyme disease if you get a tick bite. Alarmingly, ticks can carry more than pathogen, and here is a tick female that we analyzed, and we found that not only contain or carry Borrelia burgdorferi that cause Lyme disease, but also carry Babiersa mecoti is a parasite that cause babiosis, which have also fever and some, Dr. Kufel will talk about it, and it causes some fever similar to Lyme disease and could be a misdiagnosis or mistreatment for Lyme disease. Rickettsia is in all the ticks, but it doesn't cause pathogen. So ticks most often hang out on bushes and drops on animals and human rubbing against them. Male ticks don't carry pathogen. If we see a male tick that is black and small, don't panic, but the female tick, they do carry pathogens, and usually they have a red bottom and they are larger than the male tick. And if you see tick on you, what to do, and this I'm going to let Dr. Cooper and Dr. Paulino talk about prevention.
Okay. Thank you, Dr. Hathout. Now I would like to invite my colleague, Dr. Wesley Kufel, who is an infectious disease pharmacist, clinical assistant professor at the School of Pharmacy, Pharmaceutical Sciences, to talk about prevention measures.
Thank you, Dr. Nagaraju. So as you can see in the figure here, the eggs are typically laid in the spring, and then they convert into the larva form in the summer, and then they continue to grow into the nymph and eventually the adult stages. The infectivity rate of when Lyme disease can be transmitted most commonly is highest in the summer months. However, we are seeing more and more cases in the spring and the fall. Essentially, any time that the ground is not frozen, there's a potential for ticks to be around. So who is at risk for Lyme disease? Well, one is the geographical location. So where we live, being in the upstate New York area, we definitely have the ticks that can transmit Lyme disease. A lot of times it's thought of having to be in very wooded areas, or in parks, or being exposed to various wildlife or animal exposures like deer, and just being more outside in the wilderness areas. But we see ticks in backyards and in just general outdoor areas. Also, with protective clothing or just having clothes on covering the skin helps to help prevent ticks from attaching to the skin. So any area of the body that is exposed, that doesn't have any clothes on it, can potentially lead to a higher risk of having a tick attaching. Also, if the tick is not recognized in a timely manner, there can be a higher transmission risk of the bacteria that causes Lyme disease. So it's important to kind of be recognizing and looking for any potential tick attachment. One of the big misconceptions is that when a tick has attached to the skin, that it instantly transmits the bacteria that causes Lyme disease. However, it does take approximately 36 hours, potentially about 24 hours for the tick to actually transmit the bacteria to the host. So some general prevention measures: it's important to be covering skin as much as possible. Generally, if you look on the Centers for Disease Control and Prevention website, it says to wear long pants and sleeves. However, that's really not that realistic in the summer months, with the really hot weather. So just keeping an eye out for any area of exposed skin and making sure you're inspecting yourself for any potential tick bites or the tick being attached. It's also better to wear closed-toe footwear because that also decreases the chances of having skin exposure if you're wearing sandals or some sort of open-toe footwear. There's also different insectant repellents with DEET that can help prevent the ticks from attaching. And then wearing light-colored clothing can help as well because the ticks, as they're known as the black-legged ticks, if you're wearing dark-colored clothing, it may be more challenging to identify the ticks on the skin or on clothing. And then also it's important to check your pets for ticks. So pets can bring in ticks from the outside to inside, especially if you have your pets on furniture or in your bed. That's a very easy way for ticks to kind of be transmitted and potentially attached to yourselves. So what do you do if you're bitten by a tick? It's important to recognize where that tick has attached, and the best way to remove it is to actually use tweezers to grasp the tick close to the skin surface. Make sure that you're pulling upward with steady, even pressure, so not trying to wiggle it back and forth. Cleaning the area after the tick removal with soap and water, and then disposing the tick in the trash or in the toilet. And then once you've removed the tick, it's important to monitor yourself for any signs or symptoms that you might develop, such as fever, rash, fatigue, and some of those other symptoms that Dr. Polino is going to be going over in just a little bit. So there is some medication that can be taken following a tick bite. So this medication is known as doxycycline. It's an antibiotic. And this is also the antibiotic that is primarily used in the treatment of Lyme disease. But it's important to know in these scenarios if you were bitten by a tick. There's specific criteria for the use of doxycycline or this antibiotic medication for the prevention of Lyme disease following a tick bite. So all of these criteria need to be met. The first one is that the attached tick can be identified as the black-legged tick or the deer tick. The scientific name for that is the Zoetis scapularis. However, just being in the geographical location of where we are, you pretty much check that box automatically. The estimated time of tick attachment is around 36 hours or more, potentially sometimes less, sometimes it's less of 24 hours. But this is important because, as what I said earlier, the tick, if it's attached to the skin, it doesn't instantly transmit the bacteria that causes Lyme disease. So it takes some time for that to occur. Generally, no one's having a stopwatch of saying when the tick was attached and how long it's been since, the tick has been removed. But generally, if the tick looks like it's larger, it may have taken some blood. That's generally checking that box for being attached for greater than 24 to 36 hours and increasing the chance of having the Borrelia or the bacteria causing or transmitted to the host. The other thing is that the doxycycline medication can be started within 72 hours of removing the tick. So making sure that you're calling or contacting your provider's office or seeking an urgent care to be able to have a prescription for doxycycline, this medication that can be sent to your pharmacy and that you can take it within that time period. The other criteria is that Lyme disease is common in the area. We automatically check that box. And then the last one is that there's no contraindications to doxycycline. So generally, this would be if you had an allergy to doxycycline or related medications within that antibiotic drug class, or if you were pregnant. So the medication, like I said, is doxycycline, and the amount that you would take is 200 milligrams. So it's 2 100-milligram capsules. It is by mouth for a single one-time dose. It is also important to make sure that you're monitoring for any signs or symptoms of Lyme disease that may develop, and if those do develop, to seek medical care for evaluation or treatment. And Dr. Polino is going to be going through some of those in just a little bit. I did want to review some of the pearls related to doxycycline. As a pharmacist, I think it's important to make sure that the public is aware of how to take this medication appropriately. So after taking the doxycycline, it's recommended to stand up or at least sit up for about 30 to 60 minutes after taking it. And the reason for that is it really helps to sort of minimize any sort of throat or esophagus related irritation after taking it, or any kind of heartburn related issues. The other thing is, especially since many ticks are attached in the summer, and this is when we're trying to prevent Lyme disease as well as maybe potentially treating Lyme disease, it's important to make sure that you're wearing sunscreen or avoiding prolonged sun exposures, because doxycycline can increase your risk of developing a sunburn. It's also important to space the doxycycline out from taking other certain supplements, or potentially just holding these supplements while you're taking doxycycline. So if you're taking calcium or iron or magnesium, it's important to make sure that you're not taking these at the same time, because if they're taken at the same time as doxycycline, it can actually impair the absorption of doxycycline. And then there's some myths that kind of historically have been thought of, but more recent information has suggested that they may no longer really be as accurate. And one of those myths is that doxycycline used to not be able to be used in children less than 8 years of age. And the reason for that was that it increased the risk for tooth discoloration. However, more recent information suggests that children can receive doxycycline for up to 21 days, and that the risk of developing any tooth discoloration is very negligible and used to be with an older formulation of doxycycline. And there has also been some more recent data to suggest that doxycycline may be used in pregnant women and may not pose a teratogenic risk or any risk to the baby, but this is something to talk about with your provider. So the best prevention is just trying to make sure that you're not bitten by a tick, being self-aware of the environments that you're in, doing self-inspections of yourself and others for any tick attachment, and trying to remove those as soon as possible.
I'd like to invite Dr. Christopher Polino, and Dr. Polino is the infectious disease physician, and he's also the director for clinical research for the Institute of Global Health at the SUNY Upstate Medical Center. Dr. Polino.
Thank you. So many people already know that Lyme disease comes in different flavors, right? So when you're initially bitten by a tick, you generally will have a reaction at the tick bite. And as that rash expands and you have this bullseye rash, which I'll show photos of, that's the dissemination of the infection through the skin. And then eventually you get into some of the disseminated phases of Lyme disease. Some of the early phases would include Lyme meningitis, where patients will have headaches, high fevers. They may have some irritation with bright lights in their eyes, stiff neck, as well as a variety of other atypical neurologic symptoms. Lyme carditis is when the infection affects the heart. And classically, what patients will describe is they'll start to feel short of breath with activity. They might get lightheaded and dizzy. And this is because the infection is interfering with the electrical activity of the heart and can actually cause the heart rate to slow in more severe cases, as low as 20 to 30 beats per minute. There are also some other side effects with Lyme carditis where the heart can become inflamed, or you can have other associated symptoms with the covering of the heart. Late disseminated Lyme is when the infection has been around the longest and you start to develop some symptoms associated with arthritis. So these are generally going to be in larger joints, but not entirely. The knee is probably the most common in terms of joints that are affected. And patients will describe, acute pain, swelling, kind of out of the blue. This is generally later in the infection. So they may have had early symptoms that were fever, flu-like symptoms when they initially had the rash, or may not have had a rash, and then develop this weeks or months after that initial presentation. These arthritic symptoms can potentially migrate throughout the body. So sometimes you might start with knee pain, then it might travel to the hip, might travel to the shoulder. I've seen patients describe jaw pain. So there's a variety of different joints that can be involved. The other stage of Lyme disease is post-treatment Lyme disease syndrome, or chronic Lyme. There are different names for this. This is a very debilitating form of Lyme disease because it can last for a very long period of time. And unfortunately, there are not a lot of great therapeutic options for this because there are a lot of different theories as to why this occurs. But this is something that will occur after somebody has been treated for Lyme disease, generally with symptoms persisting for greater than 6 months after the initial infection and treatment. So early Lyme disease, I kind of touched base on this a little bit with the rash. This is going to occur in the first couple of days or up to a month after the initial tick bite. In many cases, patients don't recall having an actual bite or a bug bite or a tick on them at any point. Symptoms are very much flu-like, as I had mentioned. Patients will describe having, a summer flu, for lack of a better term, where they'll have fevers and chills. They may have some bad headaches. They generally feel very wiped out and fatigued, to go along with potential muscle and or joint aches. There may also be some swollen glands or lymphadenopathy that can occur in these cases. Now, the erythema migrans rash, or the bullseye rash that people talk about, is something that if you see it in this region during the summer, spring, fall months when tick season is at its highest, this is Lyme disease until proven otherwise. This rash does not always have to look like a bullseye. It can look like a uniform red rash. Sometimes you can have multiple rashes in one patient at one time. And sometimes you don't have a rash at all, depending on if the rash is potentially lighter in coloration, hidden somewhere in the body, or just maybe not present at all. The rash is generally not something that people identify by feel. Very rarely have I had scenarios where the rash is painful or irritable, or there's any irritation, or if there's any itchiness. It's not typically symptomatic from that standpoint. Again, it can appear on any part of the body. The ticks are smarter than us, so they find places to hide and to stay attached without detection, and sometimes can travel up into your scalp, into your hair, where it's harder to see a rash, or in areas of our body where we can't turn and see. And as I mentioned, the rash can sometimes appear atypical. So on the bottom left is kind of a classic bullseye rash. You can see it's very kind of uniform. If you look very closely at the very dead center of that rash, there's a little mark. That's where the tick was attached. And then the infection is basically spread through the skin from that point. And you see this kind of area of pale surrounded by another area of red that marks that bullseye. That being said, as I had indicated, these rashes don't always look like that. The one on the top right is consistent with erythema migrans. It's a painless, red, blotchy rash. Sometimes, again, you'll see a little tick bite or a bug bite at the very center of that rash as well. And then in some unfortunate individuals, they can have rashes that can spread up and pop up all over the body, as you can see in the bottom right. So the term that gets thrown around a lot with Lyme disease is it's the great mimicker. This term is actually somewhat taken from the syphilis world, because that's where we first used that. But it basically means that Lyme looks like a lot of things, which can make the diagnosis of Lyme disease very tricky. So There are other tick-borne diseases that we think about that can be present. There are ticks that are found in the Ixodes scapularis or deer tick, such as Powassan virus, babesiosis, anaplasmosis. There are other ticks that can also transmit some of these diseases, like the Lone Star tick and the American dog tick, that can spread things like Rocky Mountain spotted fever, other rickettsiosis, Ehrlichia, which is generally most strains spread in some of these other ticks as well. And then if you're down south, there's something called Southern Tick-Associated Rash Illness, or STARI, that can look very much like Lyme disease, but does not appear to be spread by the same organism. Additionally, there are a lot of other things that look like Lyme, and it's important for your doctors to keep an open mind and not think that everything is going to be Lyme disease when you come in with some of these symptoms. I've diagnosed several patients with other rheumatologic diseases over the years, chronic fatigue syndrome, other rash diseases, other neurologic processes, psychiatric conditions, and cancers can all potentially mimic some of the symptoms that you present with Lyme disease. Now, this early localized Lyme, where you have the rash, generally we don't do any lab work. Many times the lab work is going to be negative early in the course of the disease because you have not had enough time to mount an antibody response. So we just treat these patients. If I see a bullseye rash, or I see a rash that's consistent with a potential Lyme rash with a tick bite exposure history, then I'm going to be treating that patient without any lab work. Treatment is generally 10 to 14 days, depending on which drug your provider will use. Doxycycline is generally the first line because it does have the ability to treat a few of the other tick-borne diseases, such as anaplasmosis. Other alternatives, if you have a doxycycline or tetracycline allergy, include cefuroxime or amoxicillin, which are also quite good, but may not cover was not part of my initial training when I was younger, but things have changed over the years, and Doxy is now on the table for kids. So if you have somebody with an early or even potentially late disseminated infection, you could potentially use doxycycline. It doesn't typically cause any kind of visible teeth staining or any problems in kids that are younger, especially if you're using shorter courses. Now, disseminated Lyme disease comes in the two flavors that I mentioned, early and late. So early disseminated includes the Lyme meningitis or some of the neurologic symptoms like neuroborreliosis, as well as Lyme carditis over on the right. As I mentioned, you can have a variety of different symptoms with Lyme meningitis that can look like typical bacterial meningitis or viral meningitis. My rule of thumb in the summer months, spring, and tick season in general is if somebody comes in with a facial droop and you rule out stroke, that facial droop is most likely due to Lyme disease until proven otherwise. In fact, we've just recently seen some cases of this. Lyme carditis, as I had mentioned before, the primary effect is the electrical activity, and people can develop a third-degree heart block where your heart rate can slow down to dangerously slow levels. And of all the different types of Lyme, this is probably the most dangerous and is likely the cause of some of the deaths that we've seen in the literature and the news. Late disseminated Lyme disease, as I mentioned, you can have some of these joints that are affected, and the swelling can be quite profound in terms of how much inflammation is going on in these joints. Post-treatment Lyme disease is the tricky one. Very nonspecific symptoms that can occur. Patients often describe feeling just chronically exhausted, just feeling bad all the time. Many of them will have chronic headaches that they've never had before. They can have joint pains and muscle aches that can migrate and flare up and calm down over time. A lot of them will describe brain fog or confusion or word finding problems, and it's all part of that post-process, that post-infectious process, or chronic Lyme. Post-treatment Lyme disease syndrome is thought to be caused by a potential variety of different causes, whether it's a neurologic damage from the initial infection, some kind of an immune-mediated process or inflammatory process associated with some of the residual proteins or antigens that are left behind in the joints. There's a potential for autoimmune development after an infection with Lyme disease. And there's also some thought that perhaps there's a persistent infection in some cases. And this is part of the reason why treating post-treatment Lyme disease can be very difficult and can be very frustrating for not just the patient, but also the providers. Because it's tough when you're trying things and they're not working for your particular patient. So this is where we want to try to prevent people from getting to by educating and doing what we can to prevent the infection in the first place. And I guess these are some of the recommended resources that patients can look at in terms of Lyme disease education and to further their education on the topic.
Thank you, Dr. Polino and Dr. Kofel and Dr. Hathout for these timely, excellent presentations. I also want to thank Assemblywoman Lupardo for initiating this effort.